to our session this morning on the challenges of developing and implementing sanitation policy. My name is Ann Thomas. I'm the Sanitation and Hygiene Team Leader at UNICEF, and this event is being co-hosted between UNICEF and the African Ministers Council on Water, or AMCOW as you may know them. The event this morning is being organized to share experiences from the hugely exciting and ambitious Africa Sanitation Policy Guidelines, ASPG initiative that was launched by AMCOW in June of this year, and to learn from some of the emerging rollout processes and insights from some of the early adopter countries. While we are really interested in what is happening in the African continent, we're also very aware that this important initiative has a lot of learning and implications for the rest of the world. So we'll be listening with a view towards hearing a little bit more about how AMCOW is feeding into learning and policy discussions around the world. So just to give a quick overview of how we'll run this session this morning, I will first be starting with a couple of points, just framing the topic of why is sanitation policy important and linking it to the earlier plenary we had this morning on safely managed sanitation and some of the discussions. This will be followed by the official opening by the Acting Executive Secretary of AMCOW, Mr. Thomas Banda, and a presentation of the Africa Sanitation Policy Guideline contents by AMCOW's Kichbawa. This will be followed by a panel discussions in which we'll further unpack and learn more on the rollout and adoption of ASPG for national sanitation policy. We'll finalize the session with a wrap up by Ms. Kellyanne Naylor, the Director of Wash and Seed at UNICEF New York. So before I move on any further in the program, just a few housekeeping issues. I think many of you who are familiar with the Pathable format will know that the chat will be on the Pathable platform. We will not be using chat on Zoom. So please do keep all your questions and comments on Pathable, and we'll try to address as many of the questions as possible as we go through. So let me kick off. Why is sanitation policy so important? We learned this morning in the opening plenary about the complex nature of sanitation, the public and private aspects of this, the infrastructure and the investments needed along the entire sanitation value chain as we move toward the ambition of the SDGs for safely managed sanitation. We also understand that to make infrastructure work, that it needs to be underwritten by effective policy, leadership, financing, data systems, and innovation that help sustain and plug these services into the broader development context of housing, of urban development, and health. And these interconnections need to be addressed through the policy process. Essentially, reaching the SDGs for this complex sector is not only about the required infrastructure, but also the enabling environment that makes it all happen. And underlying this are clear, coherent, consistent, understandable policies that get everyone working in the same direction, that help frame the institutional accountabilities for implementation, data for regulation, and help mobilize the much needed financial resources into implementation strategies and practical plans that galvanize action. However, what we found is that the reality is that many existing policies are missing critical elements or are ambiguous, contradictory, or fragmented, and not always rooted in effective data systems. And hence, they don't effectively support the creation of this enabling environment. And these are some of the themes that were picked up in AMCOW's 2019 report that assessed the sanitation policies of 26 countries and found the following. Only three countries out of the 26 had included the core elements of an adequate sanitation policy, addressing such issues as the targeting of population groups, including the poorest and most vulnerable, or defining the legal frameworks that govern policies. Many were devoid of even mentioning on-site sanitation and consequently overlooked the issue of safe management of excreta along the sanitation value chain. We didn't see equity and inclusion concerns addressed, nor issues like MHH, menstrual health and hygiene, or the safety and health of sanitation workers across the service chain. And of course, these issues of policy quality and comprehensiveness are not unique to the African continent, but they are trends found globally. And hence that is why we're looking to the ASPG process for inspiration and guidance on how we make robust policies that translate into effective action on the ground. So the overall call to action this morning is to support the shift toward paying equal attention to the enabling environment for sanitation, to build the enabling environment, support political leadership, and the effective data and financing systems that help to build infrastructure. So without further ado, allow me to introduce Mr. Thomas Banda, AMCA's Acting Executive Secretary, to present the welcome and opening remarks. Kitch, do we have Mr. Banda with us this morning?
Yes, and he's having a bit of technical challenges, but we're together and we will resolve it in less than 5 seconds.
Okay, thanks very much, Kitch. So we'll just hang on while while Mr. Banda is coming online.
Okay, all right, thank you.
So maybe while Mr. Banda is coming online, I just wanted to reflect a little bit. I wanted to reflect a little bit on some of the themes that came out of this morning's session. Not sure how many of you had the chance to join the plenary discussion, but we were tasked with trying to address some of the issues that were coming out of that. There were specific questions on how we address the intersectoriality of sanitation sector, how we address issues like climate resilience, and looking at the 5 dimensions of action that are needed to progress action on sanitation. So referring specifically to the SDG accelerator areas, the areas of financing, data, governance, innovation, and capacity building. And these are all themes that we're really hoping this morning through our sort of all-star cast of players coming from government, technocrats across the African region will get it. So let me go back to Kitch and Mr. Thomas Banda for the opening remarks.
Good afternoon. My apologies. I think I had some technical hitches, but nonetheless, I'm here. Your Excellency, the representative of UNICEF, New York, Your Excellency, representative of the Bill and Melinda Gates Foundation, Your Excellencies, honorable ministers of the Governing Council of AMCA, Excellencies, the representatives of RTI International and World Vision International, distinguished panelists from Kenya, South Africa, Zambia, SOAS, AFDB, and WHO UNICEF GMP, distinguished members of the AMCO Technical Advisory Committee, AMCO collaborators, donors, partners, and friends, distinguished participants at this year's UNC conference, ladies and gentlemen. It is with much pleasure that I wish to welcome you all to the AMCO UNICEF session at this year's UNC Water and Health Conference. The theme for this session is the challenges of developing and implementing sanitation policy. Let's build capacity to accelerate progress. Distinguished guests, given current challenges vis-a-vis the COVID-19 pandemic, you will agree with me that there couldn't have been any theme better other than this. We are indeed most grateful to you all for joining us to discuss the topic of the day and the way forward towards improving the sanitation enabling environment of the African continent. Excellencies, distinguished guests, ladies and gentlemen, the 2008 Sharm el-Sheikh Declaration called on African heads of states and government to raise the profile of water and sanitation and to significantly increase financial resources for the achievement of water and sanitation for all. The 2015 Ngo Ministerial Declaration further called on African governments to prioritize reaching the poor and most marginalized with adequate sanitation and hygiene services and to achieve universal access to adequate and sustainable sanitation and hygiene services and eliminate open defecation by 2030. This is directly in line with Sustainable Development Goals, especially Goal 6.2. The aspirations of Africa Agenda 2063, the Africa we want, which is the strategic blueprint for Africa's long-term socioeconomic transformation, also calls for an integrated, prosperous, and peaceful Africa. Distinguished guests, you will agree with me that all these continental and global aspirations and frameworks cannot be achieved without access to adequate sanitation and hygiene for all. Accelerating progress towards self-sanitation and hygiene is therefore very critical for human development and economic transformation of the African continent. In line with this, AMCO, in collaboration with member states and stakeholders, developed the African Sanitation Policy Guidelines to help member states to develop and review their sanitation and hygiene policies and strategies to respond to present and future challenges. Excellencies, distinguished guests, ladies and gentlemen, the implementation of the SPG across the African continent demands a collective effort. AMCO alone cannot implement the SPG without the support of member states, development partners, and stakeholders. It is against this background that I consider today's session for further discussion on the SPG and capacity development for accelerated progress very apt and timely. Excellencies, distinguished guests, ladies and gentlemen, given the panelists assembled for this discussion from Kenya, South Africa, Zambia, ESOAS, FDB, BMGF, and the UNICEF WHO GMP, I'm confident that there will be lots of learning emanating from this session. I'm very sure that at the end of the day, we shall be more informed about the Africa Sanitation Policy Guidelines, understand the support mechanisms available to adopt the SPG, and how to access this support. Our partners and collaborators will also understand the opportunities available to get involved with improved understanding of how the SPG can be adopted or adapted continentally and globally for enabling sanitation policy environment towards achieving the SDG 6.2 targets of universal access to safely managed sanitation. In addition, this discussion will also help us have a better understanding of the impact of enabling policy environment on accelerated and sustainable sanitation delivery and the opportunities for networking and experience sharing. Excellencies, distinguished guests, ladies and gentlemen, the more we have many countries uptaking and using the SPG, the greater our chances of building resilience faster towards achieving the Sustainable Development Goals 2030 and Africa Agenda 2063. Excellencies, distinguished guests, ladies and gentlemen, on this note, I wish to warmly welcome you all to this discussion, and I hereby declare this session duly open. Thank you for your attention.
And you are muted, sorry. And could you unmute yourself, please?
Sorry, that's a technical glitch here we're having this morning that I periodically cannot unmute myself. So just asking our technical assistant, Manal, if you could please give me the ability to unmute myself going forward. So just thank you very much, Mr. Banda, for that great introduction to the session and to the ASPG. I'd like to turn over now to my good friend, Kitch Bawa, who is the sanitation manager at AMCOW, and he will guide us through the contents and really unpack what we have in the ASPG, what you would find in the ASPG, and really the ambition of the rollout across the continent. So over to you, Kitch.
Good. I couldn't unmute myself too. Thank you very much, Anne, for the introductory remarks, and thanks to the Acting Executive Secretary for the welcome remarks. I understand that BC will move my slides, so we can, without further ado, move to the first slide. And ladies and gentlemen, welcome to this session. Like Anne said, my job is very easy. I will walk you through the ASPG, and I hope that you go online to the AMCOW website and find a soft copy for yourself, or hope that when we meet soon, you can have a hard copy. And the outline of my presentation will start with a brief intro of what the African Ministers' Council is, for those who are not aware and informed about who we are and what we do. And then I will give you a brief overview of the ASPG, as it were, and tell you about the rollout strategy that we've put in place to ensure that the ASPG is uptaken by the member states of the African Union, and then also inform you about the opportunities to be part of the rollout process, and I'll be out of your way. And so about the African Ministers' Council, it was formed in 2002 in Abuja by governments of the African Union, and it is, as we know it today, a delivery mechanism on water and sanitation of the Specialized Technical Committee on Agriculture, Rural Development, Water, Sustainable Environment of the African Union. And that makes AMCOW one of the organs of the African Union. And the vision is an Africa where there's an equitable and sustainable use and management of water resources for poverty alleviation, socioeconomic development, regional cooperation, and the environment. And we hope to achieve this as way of our mission by providing political leadership, policy, direction, and advocacy in the use and management of water and sanitation. AMCOW has a strategy the long-term strategy 2018 to 2030, and the second strategic pillar underscores the importance that the continent attaches to sanitation and hygiene. Hence, the second strategic pillar is focused on ensuring safely managed sanitation and hygiene. And in line with that strategy, the African Sanitation Policy Guidelines was developed. And so what is the African Sanitation Policy Guideline? The ASPG, as you know it, is a guide for African governments, policy formulators, and implementers on the continent and other stakeholders on the process and content of developing an inclusive sanitation policy capable of helping the continent to achieve the SDGs 6.2. And it can be applied for review, revision, and development of sanitation policies and implementation strategies. And the scope of the ASPG covers not just fecal waste in terms of human feces and urine and cleansing materials, but it also covers hygiene, mainly menstrual hygiene management and hand washing with soap. And the process of the ASPG addresses the critical gaps in sanitation policies that were mentioned in the introduction by Anne, based on the assessment that AMCOW did prior to the development, as part of the development process of the ASPG. And following the assessment with the ASPG, as the development process has also been a very widely consultative process involving different stakeholders within the continent, but also it has gone through a very robust peer review. It's interesting to see Clarissa right in front of me in our picture as one of the technical experts that has been involved in the process. So what is the content of the ASPG? So the ASPG has 4 broad parts. And the first part is mainly the first chapter of the ASPG. And that chapter gives you an idea of what the ASPG is about, and it covers the scope that the ASPG covers. So this is like an intro, and it tells you of how to apply the guidelines as you review your sanitation policy or as you develop a new one, as it were. The second part is basically how a policy development process is supposed to be. And it has a flow chart that gives you a stepwise decision-making, process on what to do at every step and who to involve in the process of the development. And then it also lays out the step-by-step process of policy review and or development. The third part is the meat of the ASPG itself. And here it tells you how to develop the vision for your sanitation policy. It gives you guidance on how to set objectives for a sanitation policy and the principles. And then it also talks about the sanitation systems on-site and non-seaward and seaward. It talks about sanitation services, the kind of services that are covered by households and individuals, and those that are covered by service providers and duty bearers. And then it also covers hygiene, as I mentioned earlier, focusing mainly on hand washing and menstrual hygiene management, and of course, how to structure behavioral change communication in your policy document. But it also goes further to outline the institutional arrangements that are needed to ensure that you have a very robust sanitation service delivery ecosystem, and then also gives guidance on how regulation sanitation can be done, whether it's on-site, whether it's non-seaward or seaward sanitation. It also gives guidance on how to structure in your policy the capacity development process, and then how to fund sanitation and what is funded by who, and also the monitoring, evaluation, and review of your sanitation policy document as you implement the already developed document. Then the fourth and last part of the document focuses mainly on the implementation strategy of the sanitation policy that has been developed. And so, in a nutshell, this is briefly what the ASPG covers. Now, following the launch of the ASPG on the 10th of June by the Governing Council of AMCAO, and of course the entire Council of Ministers, the Secretariat has put in place what we call the strategy for the rollout and uptake of the ASPG. And the strategy has several pillars, as you can see them standing in different colors. They are meant to cover different parts to ensure that the stakeholders and what needs to be done are all in place. First of all, we have the policy assessment tool, which we will be assessing all the sanitation policies of the continent to ensure to know where they are. And also, using that tool, we'll be setting up what we call the ASPG dashboard, which will be reflecting the status of the sanitation policy of each country. But also, this will serve as the baseline for the ASPG uptake tracking system that we have developed that I'll talk about later. Now, the strategy also has this benchmarking system that we developed, which is called the Africa Sanitation Policy Index, which is a scale of 0 to 5, from 0 to 5, indicating increasing alignment or comprehensiveness compared to the ASPG of a particular policy. So this will be used from the beginning after the assessment to know the status of each policy, but also as we'll be using a traffic light system, which I'll talk about in the object tracking system. It will show you how the sanitation policy is improving and evolving as countries improve in the uptake. Now, we also have, as part of the demand management system, we have the ASPG demand form, which is the first step for member states who are the primary users of this, whether at national or subnational level, to indicate their requests and indicate, express their interest to use the ASPG. And that form is online on the AMCA website, and we are continuously creating awareness on intending users of the ASPG to fill the form. Then we have also established a partner coordination and engagement platform, which will bring together all the different partners working in different parts of the continent, doing different things in different countries, to come together to share experiences to ensure that the standard is maintained and we do using the ASPG as required. Yes, and other parts of the strategy includes also a high-level stakeholder engagement to ensure that we get the needed political will that, of course, is the first step towards countries developing their interests to use the ASPG. And to do this, we will be putting to very good use the AMCA Sanitation and Hygiene champion in the person of the First Lady of Sierra Leone, Her Excellency Fatima Mada Bio, to engage at a very high level different political leaders and policymakers on the need to set the fundamental foundation for sanitation improvement by developing inclusive sanitation policies. We will also be doing some capacity building for stakeholders on how to engage and use the ASPG in developing sanitation policy. And of course, we will be having, we'll be tapping from a pool of technical experts to ensure that wherever expertise is needed in particular areas of sanitation policy, whether it's in regulation, whether in monitoring, or whether it's in the institutional arrangements, experts that will help the users of the ASPG to be able to effectively deal with those different parts in the policy that they will be developing. And so those are the key pillars of the rollout strategy, among many others. And as I round up, it is my pleasure to inform those who do not already yet know that the ASPG is one singular opportunity for the continent to improve the enabling environment for sanitation improvement towards accelerating progress towards achieving the SDGs. And I mentioned earlier that we have the demand form. So I urge all users to use the demand form, to go to the website. You can see it there, the link in that presentation, which will be also uploaded on the platform for this conference. And there are other opportunities for people, for donors or other organizations that are willing to support sanitation improvement to fund AMCA's coordination, monitoring, and tracking and knowledge management efforts towards the uptake and use of the ASPG. And there are also opportunities for countries to benefit from funding support in developing their sanitation policies using the ASPG. There are also opportunities, like I said, you can join your pool of technical experts as individuals or consulting agencies, but also you can join our policy coordination and engagement platform as agencies to support the ASPG rollout in any way that you comparative technical expertise can permit. Thank you very much, and we look forward to having you join us as we roll out the ASPG across the continent and as we support countries to use the ASPG to ensure that everyone across the continent has access to sanitation, safely managed sanitation and hygiene before 2030. Thank you.
Great, thanks so much, Kitch. That's a great introduction to the ASPG for those of you who may not be familiar. And as you can see, this is more than just a set of guidelines. It's a concerted effort across the continent to really support and have it be a all hands-on effort between partners and governments, led by governments, but needing that strong support from the sector to really move forward. So we're all standing behind AMCOW and looking to see how this rolls out and what we can learn. So I think I'm not seeing any questions on the chat board at the moment, and that's okay, but maybe as we go along, what I can ask is if you do have any questions to keep them in the chat box, and we can still have some questions answered by Kitch and team in the chat box. And I'll also ask Kitch and my colleagues from UNICEF if we could share some of the links to the demand form and some of the other tools that you mentioned that would be useful for people to see what exactly these are about. And for anyone who wants a background on the guidelines themselves, those are also available online. So I think we'll, in the interest of time, jump into the panel discussion. And I'd like to first introduce the panel, who we're really lucky to have with us today. First, we'll have the engineer Kimanthi Kiango, who is the Acting Director of Sanitation Management and Head of Development Corporation within the Ministry of Water, Sanitation and Irrigation in Kenya. And he'll be talking to us a little bit about the early adoption process of Kenya with the ASPG guidelines and how they've used the actual policy process to stimulate institutional accountabilities and address some of the thornier issues within the sector. We'll then be joined by Dr. Sudhir Pillai, who is the Research Manager for Sanitation within the Water Research Commission in South Africa. And he will be talking to us a little bit about policy considerations, looking specifically at on-site and FSM systems in South Africa. We'll then have Mr. Peter Mutali, the Chief Inspector for the National Water Supply and Sanitation Council, or NOWASCO, from Zambia, talking to us more about regulation considerations for non-sewered sanitation systems. We'll then go to Ms. Yvonne Magawa, who is the project manager for the Eastern and Southern Africa Water and Sanitation Regulators Association, or SOS, and she'll be sharing with us some guiding principles for the region in terms of regulating sanitation. We'll then go to Usenu Gwene, the Chief Sanitation and Hygiene Officer in the Water and Security and Sanitation Division at the African Development Bank. And he'll be talking to us a little bit about creating demand and supply for appropriate funding and financial mechanisms for achieving the vision of sanitation policy. And we have two more speakers. We'll be talking a little bit about capacity development for implementation of sanitation with Eric Momanyi, who is a Senior Program Officer with the Bill and Melinda Gates Foundation. And last but not least, we will be having our colleague, Tom Slaymaker, who is the co-lead for the WHO UNICEF JMP program for WASH, giving us some tips on data for advocacy and policy formulation. So without further ado, I would like to jump into the panel discussion. And I have a first question for our panelists from Kenya. Congratulations to Kenya for being the first country to adopt the ASPG in the process of updating the country's sanitation policy. The responsibilities for sanitation, as we understand it in Kenya, are shared across several ministries, including the Ministry of Water and Sanitation and Irrigation, Ministry of Health, Ministry of Environment, among others. Can you share your experience addressing institutional accountabilities as part of the policy development process? And what was the motivation for adopting the ASPG? So over to you, Mr. Kimanthi. Mr. Kamati Kiongo, are you with us? See. Okay, let me, I think in the interest of time, I'll skip to the next question for our next panelist while we perhaps look at, we did have Mr. Kamati earlier, so I'm not sure what has happened to him, but we'll move to the next panelist, who is Dr. Sudhir Pillai. So Dr. Pillai, based on South Africa's experience, how do you see the role of ASPG in guiding future development, revision of sanitation policy and strategy that meets the needs of different contexts, as well as covers all components of the sanitation service chain in your country? So over to you. Sudhir, this is your question. Are you there?
He's asking to be unmuted, Anne.
Oh, okay. Manel, could you please ensure that our panelists are able to unmute themselves? We'll need Kamati Kiongo and Sudhir Pillai to be able to unmute themselves, please.
Yeah, I think the previous speaker was also available, so he was muted. Do you want to skip to him first, Anne? Because you did ask him the question first. He is available.
Okay, I don't know if he's unmuted. Let's just see. Kiongo, are you there? Sudhir, why don't you start, and then we can go.
Yeah, I can tell you our journey. You know, he's right. Certain parts reside in different departments, especially when you look at the disposal of sludges, whether it be from non-sewer to non-sewer or sewer type of systems. You know, we have two departments here. One is Environmental Affairs and one is Department of Water and Sanitation. Once we transfer sludges, it goes into the domain of Environmental Affairs. When we developed the Sludge Guidelines, so this was the early 2000s, we actually developed them with the Environmental Affairs. So you have this communication between the departments. And I think if you read the ASPG, the guidelines, it talks about the consultative processes that you have to go and which departments that you need. And so you have to bring the partners together. And I think the guidelines is quite comprehensive in that aspect, where it speaks to bringing people together and how you do that. So now I get what the guys from Kenya are saying. It's not only a Kenyan problem. You find this throughout the sub-Saharan Africa. You'll find this challenge. But as I said, the guideline is quite comprehensive. They go from the basics right to the capacity development and even the market analysis and those type of things. So I hope I answered the Kenyan guy adequately.
Great, thanks very much, Sudhir. And let's just check that. Okay, I think we're now going to hear from Kenya. Over to you, sir.
Okay, thank you very much, Anne. I'm now able to unmute myself. Just to share the Kenyan experience, I think the background is that we were informed about the policy formulation by four key elements: the Constitution of Kenya, which gave water and sanitation the human rights dimension. Two, there was the issue of devolution, which gave a national government a mandate for policy formulation and the county, sub-county governments to do the implementation. And then we had a reorganization of the government to ensure that those dimensions are taken on board. And that gave the ministry the mandate for a national sanitation management arrangement. We brought together our stakeholders, sanitation stakeholders in 2019, and we were able to have a sanitation conference where a communique came out that stakeholders agreed that we need to review the space of sanitation to ensure that we have a comprehensive policy that covers everything, basically the whole value chain. And to do that as a ministry, I think we did a very comprehensive sanitation mapping, stakeholder mapping. And like it was mentioned, we brought on board the Minister of Health, Minister of Environment, the environmental agencies, water service providers, the private sector, the non-state actors. We brought them together. We prepared a concept note. We articulated to them, and we formed what was called a very comprehensive, inclusive national steering committee to drive the process. This was key to ensure that everybody among those stakeholders was part of that discussion. We had 2 rounds of consultation across the country. One, we collected the views. The second round, we were able to go back and tell them, depending on their views, this is what the draft that we had discussed. What was very critical in this discussion is that this process of consultation was spearheaded by the steering committee. Some of the sessions will be chaired by the county governments, others will be chaired by the Minister of Health, others will be chaired by the non-state actors. And that process was largely guided by the ASPG, and we customized it to ensure that everybody is included, everybody accounts for it, everybody starts thinking about their roles and mandates, possible mandates. And with that process, in about 4 months, we were able to come up with a draft national sanitation management policy that is awaiting now ratification by the necessary legislative arms of the government. Thank you very much. Back to you.
Okay, thanks very much for that intervention, Mr. Kiango. I think this, Kenya's experience as an early adopter of ASPG is going to be, hugely inspirational and a real source of learning for other countries in the region. So we're really glad that you could share some of those experiences and the utility of having that steering committee already in place that was able to take this up quite quickly. So I'd like to shift now to Mr. Peter Mutali with a question for Zambia. So based on Zambia's experience in regulating non-sewerage sanitation, what lessons can you share on regulating on-site and FSM systems? And how is this reflected in your policy? Over to you, Mr. Mutali. And please do let us know if you can't unmute so we can see if we can help you with that. Manal, can I ask you to please help Peter? It looks like he can't.
Yes, I'm trying to make work with him.
Okay, and maybe for all the panelists, we can do that.
Okay, sorry, I think I was muted. Sorry, I was muted. Yeah, so I was trying to say that in the case of Zambia, we do have the Water and Sanitation Policy. We do have the Water Supply and Sanitation Act. And when you look at the Act, it clearly defines what sanitation is, talks about offsite and onsite, and all other processes that come after the collection of sludge. Now, let me say that I think since 2000, when we started operating as a regulator, we have been focusing on sewerage services until 2015, when we said, look, part of on-site sanitation, because it's also a mandate, and it's also in the mandate of the commercial utilities that provide sewerage services. So we embarked on that process, which took about 3 years. And in 2018, actually, we came up with what we are calling a provision and regulation framework for urban on-site sanitation. And I think with that launched in June 2018, we went ahead as a regulator to amend operating licenses for all commercial utilities in Zambia to include on-site sanitation in their operations, and also to allow them to cover the entire district regardless of the area. So that was June 2018. And after that, we gave a directive to all the commercial utilities to change their names by July 2019 to reflect the new mandates. So now they are called water and sanitation companies, not water and storage companies. But along the side, we're also developing a number of tools for us to implement this. We're trying to develop the code of practice for on-site sanitation provision, which is a standard by Zambia Bureau of Standards. We're also revising our NWASCO information system to include on-site sanitation. In fact, for those that read our sector report, you'll see that the past 2 years, we have been reflecting actually on-site sanitation information, pit latrines, septic tanks, they're part of our report. So now, looking at what is happening now is that the commercial utilities are fully responsible for providing services in each and every town or district. So whoever wants to provide a service has to provide under these commercial utilities, and they sign what we call performance contracts. And this has already started, although there are some commercial utilities that are still lagging behind, but the process has started. If you come to Lusaka Water and Sanitation Company, which is in the capital city, you see that they have advanced, they have signed these performance contracts with employers so that they work under a regulated environment. So in terms of pricings, we have developed pricing strategy for on-site sanitation. We have developed minimum service levels for this on-site sanitation. We have developed all these guidelines that should help us regulate this. And on top of that, actually, we have quite a comprehensive strategy or plan in terms of how the sanitation service provision will take place, particularly on-site sanitation. So the framework that we developed, let me just emphasize, it streamlined the roles and responsibilities of each and every institution. For example, the ministry responsible for water and sanitation is in charge of policy. NWASCO, where I'm coming from, we are in charge of regulation. The commercial utilities, service provision. Zambia Environmental Management Agency is responsible for environment, and they license all the trucks carrying fecal sludge. We look at the local authorities, they're responsible for enforcing public health and also ensure that the facilities that are constructed for on-site sanitation according to standard. We have got the Zambia Bureau of Standards helping to develop the standards. So we have actually streamlined all the activities for all the different institutions and organizations so that we work in harmony. And this is what we are doing at the moment in Zambia. So all the private employers, the community-based employers, now they're working under regulation through the license. So going forward, we'll see more of database being created, surveys being done. We are doing a lot of that actually in the country. So 2022, if you come to Zambia, actually, we'll see a lot of activity in terms of service provision and regulation concerning urban on-site sanitation. Maybe for now, those are my few comments. Thank you.
Okay, thanks very much, Peter. I think these are really great insights from Zambia, and I think hearing you talk about harmony in the sector is really music to my ears, and it's really great to hear of all the progress. So just before I go forward, I wanted to mention there's a comment in the chat box for, and I'm going to say this is for Kitch. If you could have a look at that, and that is really looking at with only 9 years to 2030, what do you believe is Africa's trajectory to reaching the SDGs? So Kitch, I'm going to leave that very difficult question for you to answer, and I think you can do that in the chat. I'd also like to ask all panelists that when you respond to a question, if we could see you, it would be great, and make Zooming conferences, that much better if we can see you and react to your expressions as well, would be great. So next up, thank you, Peter, and great to see you. And I'm sorry we didn't get to see you earlier. I think you might have forgotten to turn on your video. So it's just a reminder. Let me pass over now to Yvonne. Ms. Yvonne Magawa, building on the comments from Mr. Peter Mutali, regulating non-sewerage systems in many countries across Africa is challenging and a lot of work. What do we need to do to ensure effective and appropriate regulatory frameworks that take care of both sewered and non-sewered sanitation systems across Africa? What would be some of the guiding principles from your experience? Over to you, Yvonne.
Thank you very much, Anne, and good day, everybody. From ESAWA's Regulators Association, which is a network of water supply and sanitation regulators from the East and Southern African region, we like to say that regulators are policy implementers. And it is very important, as has already been highlighted, that the enabling framework is there through policy and legislation. And through a harmonized regional approach, as ESAWAS, we've been able to develop a regulation framework and strategy for incorporating non-sewerage sanitation in particular into regulation. As Mr. Mtali has already said, for a long time, we focused on sewerage. And using this regulation framework and strategy, we've been able to define the roles and responsibilities across the whole sanitation chain. This means from capture and containment all the way to disposal and reuse. We have been able to define what role policy should play, who are the responsible actors at the regulation level, who are the responsible actors, what roles do they have up to service provision level. And we have detailed that in each segment of the chain so that it is clear when we are intervening, who is intervening at which point. That is very important, and all that must be couched through policy and legal provisions. We like to give a regulation, we like it to be understood analogy of football. You know, there's a referee, there's players, there's an audience. If there were no rules in a football game, you would find the audience, if they're not happy, they'll jump on the football pitch and try also to participate in the game because they think they can play better. You would not know which goal, which team is playing in, they can score on any side. So regulators act more like a referee to bring that level of sanity, to bring that order, and to allow a fair game to be played. So as policy implementers, regulators look on the policy side and ensure at the end of the day that it is the citizen, the consumer, who has good quality service at an affordable price. Of course, there are significant opportunities for regulation in this because you have a mandated service provider, as Mr. Mtali put it. There is a utility who is responsible for the service, for service provision, and that entity can be held accountable. And who is holding it accountable? That is where regulation comes in. In terms of the tariffs that are being charged to the consumer, the regulator comes in to ensure that there is fair service for a fair price so that consumers are not bearing the inefficiencies of a utility at the end of the day. And also most important in our strive to SDG 6, as you already said, 9 years to go, it means the poor and marginalized also would not be left out because the regulator can ensure that there is an inclusive service for all. Of course, there are challenges in bringing the sector to this level. There are so many actors at the moment. The sector has been so fragmented for a long time. So it would take regulation as well as other stakeholders working together to actually harmonize the actors in the sector and ensure that everybody is now synergizing and working to a very good accountability structure. Also in terms of financial and resource planning, it would ensure that resources are being put where they're most effective and catering for both sides, sewered and non-sewered across the board. And as the ASPG says, you need to link both sides of the chain, the sewered and non-sewered, if regulation is going to become effective. At the bottom line for regulation and indeed service provision is that data must be available. This is our biggest challenge because for a long time, we have not collected data on non-sewered service provision, and it is a fundamental base. So there needs to be strong support for baseline studies to be undertaken so that these can then inform national strategies that are being put in place and the interventions that are coming on board to get us to SDG 6. Thank you so much.
Okay, thank you very much, Yvonne. That was really, really insightful, and I really like the analogy of the sector being like a football game, and the regulator's role as that of the referee, ensuring fair play and that everyone sticks to their respective roles and remain accountable. So I think this is excellent, and I'd like to also, take this opportunity to take sort of a pause in our panel just to look for any questions coming from the audience for any of our panelists so far. I'd also like, it's a 10-minute warning, so I think we don't have much time. Sorry, this just came up. So if there are any questions coming through, I'm not seeing many, but there is one question coming now on capacity. So maybe what I could ask is, Manel, if you can ensure that our upcoming speakers are all able to unmute themselves. We have Kelly, we have Eric, and we have Tom about to speak. Could you please ensure that they're able to unmute while we take one question for Yvonne, which is around capacity building for the regulators themselves. How can regulators build their capacity in this space, given that there is so much growth of the sector in terms of this move towards non-sewered sanitation? So maybe over to you, Yvonne, for that follow-up question.
Are you requesting me to answer it right now?
Yes, go ahead.
Okay. Thank you so much. Yes, very briefly, in terms of capacity building, yes, non-sewered sanitation regulation is relatively new, but we are gaining experience, and we're saying we are not starting from zero because we have a lot of experience from dealing with the water supply sector. And for most parts, the beginning of the water supply sector is similar to where we are with non-sewered sanitation in particular. So using that knowledge, we are now beginning to put together some training programs, training courses for regulation. And within the next year or two, you'll see us actually putting up a dedicated center for regulation to assist other regulators or incoming regulators and regulators being established to be able to gain that core knowledge that is needed to be able to undertake effective regulation. So capacity building is very, very key. And we are also able to share experiences, especially us coming from an association. We are using that, like Zambia's case, we then transfer that knowledge across our members to be able to accelerate uptake of certain regulation approaches. So that is how we work on capacity building. Thank you.
Great, thank you very much, Yvonne. And I'd like to now invite Mr. Osenu Gwene for the next question. Osenu, the question is, what are the opportunities that the African Development Bank sees in the ASPG development and rollout for financing sanitation across Africa, and what opportunities in particular do you see? Over to you. Manal, could you please make sure that Mr. Osenu can unmute himself?
Trying to find him. Not sure if he has his name written on his.
Okay, maybe while we are looking for Osenu, I'm going to jump. We just have a few minutes left in this session, so I'd like to make sure that all our panelists have a chance to speak. So maybe moving over to Mr. Eric Momanyi. Eric, BMGF is a strong supporter of the ASPG and sanitation in general. What are the opportunities that you see for capacity building, for policy development, and specifically in this area of safely managed sanitation and the rollout of the ASPG? Over to you, Eric.
Thank you very much, Anne. First, I want to congratulate MCOW and the many partners who were part of the ASPG process. And then secondly, I want to congratulate Kenya for being the first country to adopt the ASPG. And as a son of the Republic of Kenya, born and bred, I am really proud of what you have done. So I just want to say that countries everywhere have been making policies for as long as governance has been in existence. However, within the sanitation subsector, we have not seen the kind of rapid momentum across so many countries at the same time as has been seen following the Africa Sanitation Policy Guidelines process. And as a foundation, we naturally engage with a large cross-section of partners from across government, non-governmental partners, as well as the development community at large. And what I see as the most consequential stumbling block towards policy change, something that MCOW and partners have been hard at work really is, I would call the need to be able to shift mental models. What do I mean by this? So the SDG for sanitation was not simply a goal adjustment from the MDGs. It is significant, it's a significant shift in paradigm, And simply getting new policies in place doesn't mean the machinery of the people, institutions, and structures that have held the responsibilities for sanitation under the MDG era simply switched into SDG mode when it was time. But shifting this mental models is not simply an issue that will be addressed by perhaps an SDG 6 webinar or some in-person workshop, or even through additional financing to the sector. A deliberate effort will be needed really to make this transition. I have spoken to a number of utility leaders who are saying that, we now understand that sanitation service delivery, including non-sewer sanitation, is now part of the utility package, but this is new to us and we need help figuring it out. I think like a week or two ago, I took part in a webinar on the role of parliamentarians in the ASPG rollout. And they were clear that MPs, members of parliament, need to be educated on what they need to know to be useful to the sector. It is our role in this sector to ensure that we make the case for sanitation, not just for the, for the audience within the sector, to a large extent, some of who are represented here, majority of who are represented here, but importantly, make the case where sanitation as envisioned by the SDG and by extension the ASPG is important to national development. Now, this mental paradigm, in my opinion, is the foundation for every other capacity gap that we are observing within the sector. And if I could be able to just quickly, list this from what we are observing. Number one is technical capacity. And I'm aware from the consultations that were led by MCOW that countries need TA on a multiple areas around policy development, from policy development itself to financing to project development, as well as TA on monitoring systems. And this is something that increasingly will be something that we all need to be able to take attention towards. And I think some of the MCOW and other partners have mentioned about this in this panel. The human resource capacity from utilities to regulators and government staff need new skills on both design and implementation of service delivery. Now, even within research institutions, sanitation as defined within the SDG has historically not been a core area of research. And that is changing, but it will take time to answer all the outstanding policy-related questions that we're grappling with. Data is another gap. And we all know that the sector is still trying to figure out an efficient way to measure SDG 6. If we are not able to measure the SDG 6 indicator on safely managed, we will not know whether or not our policies are succeeding. And then obviously we talk about financing because we know that when new policies come into place, they will require financial resources for implementation, especially as mandates get clear and clear targets for national targets get to be set. So while we need to work on all these issues, I believe that an essential yet achievable task really at the beginning is to ensure that all key decision makers, all of them, are reading from the same script. Thank you.
Thanks very much, Eric. That's great. And I think you touched on a very important point about data, which is leading into our next speaker, Tom Slaymaker. So Tom, I would invite you to maybe comment on the importance of data systems, not only for policy, but for action in countries. And I'm really sorry, but I think you'd have to make it very short just to allow Kelly to come in for a minute at the end. So if I can ask you to come in with a brief intervention, that would be great. Thanks.
Okay, thanks, Anne. And I think it's a really interesting discussion. As you know, we're responsible for global monitoring. And if we reflect on the progress we've made in terms of monitoring safely managed sanitation in Africa, globally, we've got about 54% of the population using safely managed sanitation services, and we estimate for Africa it's around 27%, so about half of the global average, a bit higher in urban, 1 in 3, than in rural areas where it's just 1 in 4 people with safely managed sanitation. And of course, we still have a very large proportion who still lack basic services and still practicing open defecation. So clearly policies have to reflect these challenges and have to be commensurate with those challenges. But monitoring safely managed really is a big challenge. Actually, we do have estimates now for around 26 countries in the African Union, so that's about half. But the monitoring challenge really depends on the type of sanitation systems that people are using. So in Africa, it's only about 17% with sewer connections, 41% unsewered, on-site, about 29% with improved latrines, and just 12% septic tanks. So clearly, on-site sanitation needs to be the major focus of sanitation policy, and it also needs to be the major focus of monitoring efforts. And our report highlighted that a lot of these non-sewage systems are never emptied, which is really underlying the need for sanitary inspections to understand whether these systems are functioning properly and whether they're effectively containing and treating wastes. We do have some information on safe disposal in situ. We do have a little bit of information on the proportion of wastewater that's being treated, but we have very little data on what's happening to the fecal sludge from septic tanks and from pit latrines that are removed from the house. We just don't know whether it's delivered to the treatment facility or whether it's being unsafely discharged into the environment. And this is a challenge across the continent, but it's also a challenge around the world. It's our single biggest data gap. But what we find is that data can play a really critical role. I think the ASPG is about system strengthening, and we're very interested in strengthening data systems, both to establish baselines, but also just then set targets and to monitor progress towards them. And it's only really by getting some data on emptying and treatment and disposal of fecal sludge from these non-sewage systems that we can really draw attention to the scale of the problem for advocacy purposes. But just from the work that we've been doing, and this includes in countries like Kenya and Zambia, where we're supporting conversations about how to strengthen national monitoring and address the data gaps. One of the key lessons, I think, is that many countries still lack a commonly agreed set of indicators for safely managed sanitation. So, different governments or different parts of the same government are still using different metrics and different indicator definitions, which makes it very difficult then to aggregate the data and to benchmark and compare progress across different parts of the country. Now, national standards may be higher or they may be lower than those we use at the JMP, but it's essential that national stakeholders have a commonly agreed set of metrics for tracking progress. And then the other is around the roles and responsibilities for routine data collection. Given the complexity that we've heard about of the sanitation chain, there's rarely a single data source that's going to tell us everything we need to know. So we need to be looking to combine information from regular household surveys, which can give us information on the types of facilities people use and whether they've been emptied, with information from sanitary inspections, which will help us understand whether the systems are effectively containing and treating waste. And then from administrative data and regulatory reports of the type that Peter and Yvonne were describing, where you're getting information on the population which are covered with fecal sludge collection services and the availability of treatment plants for both fecal sludge and for wastewater. So we need to be getting data from these different sources and then aggregating them and putting them together to get an overall picture of what's going on in the country. And many countries in Africa and elsewhere have a partial picture of what's going on. But regulatory data coverage is still really low, and especially in rural areas. So we need to think about building a more comprehensive picture, a more comprehensive national data system along the lines that I think Peter Matali was describing, not just in Africa, but also in other parts of the world, in order to be able to accelerate progress towards SDG 6. I'll leave it there. Thanks.
Great, thanks so much, Tom. I think these are really important points, and I think we've seen in many countries now that just that process of strengthening data and coming up with coherent definitions can be catalytic in and of itself, and translating between that policy formulation exercise into real action and meaningful advances in the sector. So I just wanted to draw attention that there are two comments in the chat box that I think it would be great to have some of our panelists respond to. We're over time now, so unfortunately I don't have time to allow everyone to respond to this verbally, but I did want to mention they're great questions. The first is from Jan Willem, looking at, the ASPG in and of itself is not the end to end this with beautiful policies, but really that the policy is a gateway to meaningful reform. So how have countries like Kenya that are adopting ASPG and like Zambia making strides on regulation, what kind of indicators are they using to show that kind of progress is being made, that this is not just a document, but it's actually action on the ground? That's That's one. And then we have a question from Ken referring to a point that came up this morning in the session about the intersectoriality of sanitation. Does the ASPG allow or provision for this kind of interplay of sanitation sector with other sectors? So Kitch, I think that's a great question for you, and maybe Peter and Kiango, you could comment on the first question from Jan Willem, but I will have to ask you to do that in chat because we're already over time, and I would like to now bring this session near to a close with Kellyanne Naylor, who is the director of the WASH program at UNICEF, to give us our wrap up and closing. So Kelly, can I hand over to you?
Great, thanks so much, Anne. And this has been such an exciting conversation. I just wanted to start by really congratulating AMCOW and Executive Secretary Banda and the whole AMCOW team for your leadership on the African Sanitation Policy Guideline development, and today for organizing this exciting conversation. And I think, as you said, this is part of the rollout plan that Kitch so clearly presented at the beginning, and it definitely feels like we're on the start of a journey together. I just wanted to share a few perspectives. I think just with less than 10 years to go before 2030, there's a lot of global attention right now on taking stock of progress and looking at ways to accelerate, go faster, especially for the most off-track targets like sanitation, to really address one of the most fundamental principles of the SDGs, which is leaving no one behind. And I think, as we've heard, the ASPG is just such an exceptional regional initiative that is promoting this enabling policy environment for sanitation transformation as a key to unlocking increased political support for universal access to sanitation. It proposes a way forward on implementation of this ambitious definition of safely managed sanitation, and also provides a model that is not only relevant for Africa, but can be emulated by so many other countries and regions around the world. And I think, just as a global community, we truly need initiatives like this to accelerate our progress towards SDG 6.2 targets. I think we've heard a lot from the panelists and speakers today, and I think it is really the insights coming from countries and partners on the ground who are really making this happen in so many concrete ways. I think it's been fascinating to hear from Kenya about your efforts, from South Africa, from Zambia. I think we're all thinking about Yvonne's memorable football analogy. I know we'd hope to hear from the African Development Bank on some of their experiences creating demand and supply for an appropriate financial mechanism for sanitation delivery. And we heard from our colleague Eric from BMGF on some insightful comments about how the importance of policy and how we can build capacity for policy development. And last but not least, we heard from Tom in the Joint Monitoring Program, who really highlighted the importance of data in data systems to be able to inform policy formulation. So all of these experiences and many others are going to be very valuable as we scale up the ASPG to reach more countries. I know time is really short, and I just wanted to say that it's so important that this process of rolling out the ASPG is catalytic and transformative, and really underpinning that we must keep in mind that policy is not enough, and that we must make sure that this policy is translated into action and results. Just wanted to really reconfirm UNICEF's full commitment. The ASPG is aligned with our new strategic plan, our plans for the Gay Plan 2.0. But what we really need is for all partners to join forces to sustain this great momentum that has already been generated by the ASPG. as well as at the global level. So we look forward to connecting with you. We plan to start practically on the ground in 2 countries this year with a partnership between AMCOW, UNICEF, with support from BMGF, and we hope that this can all provide us valuable lessons going forward. Just in my global role with UN Water, I just wanted to say how important this is as part of the SDG 6 Global Acceleration Framework, and that AMCOW is really leading this in the lead up to the World Water Forum in Dakar in 2022. And this is going to be such a valuable contribution to the UN 2023 Water Conference, which will be the very first UN conference on water and sanitation in almost 50 years. This will be such a valuable moment to highlight the ASPG and the world, the progress that Africa is making on sanitation. So this, we must act now. The future of our children and the next generation depends on what we do now. Children must have a clean and safe environment to thrive and grow to their full potential. So thank you so much to the speakers and panelists for your rich contributions. And most of all, I want to thank the participants, because we're really counting on your action to make this sanitation vision a reality on the ground. So thank you very much for your attention in this session. Wishing you a fantastic week ahead at the UNC conference, and looking forward to joining forces to implement ASPG in practice around the world. Thank you so much, and wishing you a great day. And back over to you.
Thanks so much, Kelly. And I think on that note, we can close the session. And thanks once again to all of our panelists. And just a little note to say, Usenu in the end couldn't join, but he did indeed have valuable insights to share on the framing of sanitation in the region and the opportunities of seeing sanitation as a business. So hope to catch up with many of you during the week. And as Kelly says, have a great conference during this next couple of days.